Hi, I'm Julia Ebbens, a health content editor at Bupa. In this three-part series, we will explore how to make a healthy change that actually lasts. We will address the science behind behaviour change, explain how to best prepare for and sustain a new change, as well as sharing some practical tips for dealing with setbacks. I will be chatting to Sarah Griffiths, a behaviour change expert. Hi, Sarah.
Hi, Julia.
As well as Julieta Correa, a Bupa Health advisor. Hi, Julia.
Hi, Julia. Hi.
I think most of us have a good idea how to be healthier. We know we should be more active, eat well, sleep better, and manage our stress. But in reality, it can be really hard to make a healthy change that actually lasts. I think it's helpful to know that it's not just a lack of willpower that makes it hard to change our health behaviours. There's actually some science underpinning the struggles we have to make a lasting behaviour change. Sarah, I know there's a model of change that explains the different stages someone is likely to go through when they're making a health change. Could you briefly talk us through what these stages are?
Sure. So this is a model known as the Stages of Change model. It's got several stages that someone may typically go through. The initial stage is known as pre-contemplation. So this happens before any change is made. And in this stage, you might not even be aware that you need to change something, or you might deny that there's even an issue with something that you're already doing.
Interesting. So, for example, you might say to yourself, I know I eat lots of chocolate, but it doesn't really matter, or there's no real impact on my health.
Exactly. So you haven't really accepted that a change is required.
Okay, so what's the next stage in the change process?
The next stage is the contemplation phase. So this is where you're more likely to be aware that you have a habit or a behaviour that needs changing, but you can get stuck here. So knowing you should make a change, but not knowing how to proceed.
So you're making progress at the contemplation stage, really, because you can at least accept something needs to change, but it sounds like you actually need some extra support and encouragement to make it happen.
Yes, and sometimes you can even go back a stage, so when you're not sure how to change, so you try to convince yourself that actually you don't need to change anything after all.
Seems like you can get stuck in a bit of an internal battle between moving forwards and staying as you are.
Absolutely, but I think the good news is that from this second stage, you can also move forward to the third stage, which is preparation or preparing to change. And this is where you start gathering information about how you'll actually make that change, such as reading relevant information online or speaking to someone who's already changed this particular habit or behaviour. So you might also start considering barriers that might prevent you from reaching your goal and think about how you can overcome these.
This stage sounds a lot more practical to me, like you're really doing the research, you're planning, and then you're actually taking those steps needed to facilitate a change.
Yeah, so it's really putting the wheels in motion for the fourth stage, which is actually making the change. So here you start to alter your behaviour, for example, by committing to twice weekly runs or having a few alcohol-free evenings each week.
I think we all know that in the beginning you can have that initial motivation and then it's really easy to make these changes and then you probably feel quite happy with yourself, but normally something seems to get in the way and you can end up back where you started. So how do you know that you've actually made a lasting change this time?
So when you've made a change consistently for around 6 months or more, then you've reached the maintenance stage. You've probably gained confidence in your ability to change and you've also probably had to overcome some challenges along the way. But this doesn't unfortunately mean that you've made a lifelong change at this point, as relapses can still happen.
So when you say relapse, what does this involve? Is it, for example, one day where you overeat, don't feel like working out or drink a little bit too much?
I'd say so rather than just having a slip up on one day or missing one workout, a relapse happens when one slip up leads to another and then another and so on. It's that negative mindset that I'm sure a lot of us recognise. So when you have a bit of a bad day or you might have a few bad days, things aren't quite going to plan. And then you feel like you may as well just give up. And then it becomes really hard to get back on track with the changes that you'd started to make. And relapse is where you might move back a stage or two in the process before reaching that long-term change. I think it's really important to say that behaviour change is complex and it can be really difficult. So there can be a lot of movement back and forth between stages or even bypassing some of them entirely.
So Julieta is a health advisor here at Bupa and she's got loads of first-hand experience with the challenges a lot of people go through when trying to make positive health changes. Listening to the stages of change that Sarah has mentioned, does any of this sound familiar to you and is it something you can relate to with your own health assessment clients?
Definitely. We often see clients that are feeling stuck at the contemplation phase, which Sarah described, or move back from being actively working towards their health goals. Challenges such as having a busy job or having to build a new routine after having a new baby in the family, or simply not knowing what to do next because the previous attempts have failed, which is common in weight loss diets, for example. It blocks the sight of seeing what to do next.
Yeah, that sounds really frustrating. Do you remember anyone who's actually made the leap from the pre-contemplation stage, i.e. when they're thinking about changing but they're not really sure if it's beneficial or something they can actually do, to making the change? Do you have an example of this you could share with us?
Yes, there's several examples, I would say, and worth mentioning is definitely the best part of our job, because we see how people change and they achieve their goals, they feel healthier and happier as well. I remember this particular client who was seen a health advisor the year before and was advised to improve his eating habits as he was found to be pre-diabetic. So just a parenthesis here, this has to do with the blood sugar levels found at that time of the assessment. He was not aware that the type of diet he was having at that time and not exercising was causing him harm, and then was advised accordingly. So when I saw him this year, he has since started exercising. He improved his diet by cutting fizzy drinks and chocolates as the main snack. And we not only saw that his blood sugar levels went back to normal, he was no longer pre-diabetic, and we saw that cholesterol has improved, as well as an additional happy factor that he dropped 2 sizes on his clothes. So only win situations. From there, we discussed what went well, we reinforced the positive results and set the next goals he wanted to achieve as he was working to a better fitness level. An inspiring journey for all of us, and he also shared this at his workplace and started to influence his team.
Nice, that sounds really positive. It's really nice to hear an example from real life when changes actually happen, so thanks for that. In our next podcast episode, we're going to delve deeper into some practical considerations for how to actually maintain that change going forwards. But for now, for those listeners who are in that early stage of pre-contemplation or even contemplation, but they're not really sure where to begin, what type of questions should someone be asking themselves, Sarah?
I think some good things to consider are, what's your motivation for making the change? So maybe you want more energy, improve your mood and that kind of thing. So identifying your reasons to change can help you to stay focused during setbacks. Also, do you know how to make long-term change? Is there a local service that can provide support or resources? Or maybe you can find some advice online through trusted websites like the NHS. It can also help to think about what might be stopping you from making changes. Maybe you've tried to change this behaviour before, but only managed short-term change, and so you think that this time it will be too difficult. Or you may be busy and you don't know how to make changes that fit with your lifestyle. So identifying barriers that can help you to think of solutions to those potential issues. And then finally, what might trigger you to move back to relapse? So maybe you've got an event coming up where it might be difficult to continue with any changes, like a holiday or a family or a work event. It can really help to think about how you could adapt your behaviour to cope with this.
Sounds like there's quite a lot to think about in these early stages, but hopefully later on it's going to help you. On a practical level, I know that making SMART goals can be a useful way for some people to focus on making a positive change. Could you explain a little bit about what these are and how they might be able to help you at this stage of behaviour change?
Yeah, of course. So SMART is an acronym that can be used for making goals a bit more defined, and it's a really important step to achieve change. Just as an example, so wanting to exercise more is a good goal, but it's quite unclear. And this is where we can bring in SMART goals. So making your goals specific and measurable, so kind of like the what, achievable, like the how, relevant, which will be the why, and also timely, so the when. So instead of increasing exercise as a goal, this could be going for a 15-minute run on a Wednesday and Friday at 12 p.m. during your lunch break when you know that you'll be working from home. So make this achievable by starting small for a new behaviour. That could be building up to a 15-minute run with walking and then adding a short run into the walk and then making the run part longer each time.
Okay, it sounds like the more precise you can be, the better the outcomes ultimately.
Yeah.
Julieta, as a health advisor, have you got any tips for someone who is considering making a change? When I used to work as a health coach for the NHS, we used to ask our clients to think about their personal motivation for changing. And this is really so they can stay connected to this, and it can help them with setbacks if they happen during the change process. Their motivation would be things like they want to feel more energy, they want to sleep better, or even just feeling less stressed. Do you have any other tips to share?
Definitely the motivation point is vital. This allows to maintain the consistency and building habits towards the SMART goals that Sarah described. As health advisors, during our assessments, we go through a discovery process. It's like an interview, which allows us to work with the client in finding what changes they want to make and why they want to make these changes. Rather than attaching a SMART goal to what they think they need to do based on their health goals, we aim to find actions that they are confident in doing so and motivated to do in a simple way. Other tips we might look at are accountability partners, whether this would be a family member, a friend, or even us as a health advisor. And another one would be having a vision for the future, which some people might want to transform this into a vision board, for example, which will keep the focus and a reminder of why they started in the first place.
Sounds like it's a really useful process to go to help people identify why they actually want to make the change in the first place. So we've discussed the stages of change. We've also talked about some of the preparations you can take, such as asking yourself key questions and also making a few SMART goals. Next time we'll talk more about the challenges of maintaining the change, and we'll also share some top tips about how you can help yourself during this next stage of the change process. Thank you for listening.